achieve really the greatest profession, the profession of nursing. We are really so fortunate to be welcomed into so many lives in their most vulnerable time for the purpose of healing, comforting, and really supporting patients in the ways they most need. This year's theme, national theme for National Nurses Week, is influence, innovate, and I just forgot the third one. Who remembers? Inspire, yes, thank you. And I think you will find our wonderful speaker today is all of those things and does all of those things. Before we introduce our speaker, I again want to wish you all a wonderful Happy Nurses Week on behalf of our CEO, Teresa Larrabee, who has joined us today, and the entire executive team. Now it's my honor to introduce one of our clinical nurses who will introduce our speaker. Heather Cochran is a clinical level 3 nurse. She works on our oncology unit and is chair of our Quality and Safety Council. Please join me in welcoming Heather.
Hello, my name is Heather Cochran, and as Mary said, I'm a nurse on 7 Sheet. It's my honor to introduce Anne Brennan to present for our Nurses Week Grand Rounds, Inspiring Nurses to Influence and Innovate. Anne Brennan is a simulation education specialist at the School of Nursing. She received her BSN from the University of Scranton and her MSN from New York University. She holds a certification in simulation from the Children's Hospital of Philadelphia. In her current role as simulation education specialist, she works on simulation curriculum development as well as integrating simulation into undergraduate course content. In addition to simulation curricular development and oversight, she is responsible for the recruitment, hiring, and training of over 50 simulation faculty per year. She has introduced experienced practicing professionals to the simulation environment, which serves to increase realism and create partnership with practicing nurses in the professional community. Most recently, Ms. Brennan has collaborated with faculty from both the Penn Graduate School of Education and the School of Social Policy and Practice on an accepted grant application for the Penn Futures Project. Their goal is to collaboratively offer an interdisciplinary simulated experience to educate students in the School of Graduate Education, Nursing, and Social Work on the mental and medical health needs of the LGBT community. Since 2014, she has served as chair for the Academic Educator Subcommittee for the Philadelphia Area Simulation Consortium and has been a current member of Planning Committee for the Jefferson, CHOP, Penn Nursing, and Penn Medicine Simulation Facilitators course since 2012. She is currently working on a simulation to train students and the community on the opioid epidemic. We are thrilled to have Anne here and to speak about nurses and innovation.
Good afternoon, everyone. My name, as she said, is Marie Hoyt-Brennan, and I am a simulation education specialist at the University of Pennsylvania School of Nursing. I am privileged and honored to be here with you today and to celebrate Nurses Week with all of you. My hope today is that you leave inspired to reflect on pivotal moments in your life that inspired you to follow your vision and commitment to caring in its fullest sense, and to identify life experiences and adversity in your life as an impetus to educate, empathize with your patients, and innovate to create a positive impact in our workplace and local communities and global society. I also hope that you explore qualities of an effective mentor and reflective inquirer in nursing and how to best capitalize on these characteristics to improve professional goals. So there are multiple episodes or pivotal moments in my life that inspired me to become a nurse. But I ask, what inspired you to be a nurse? I ask you to take a few moments to reflect back on what inspired you to follow this path. Oh no, I may make you work here. I am an educator, not necessarily a lecturer, and I'm one that specializes in experiential learning. So you'll be working really hard over the next 45 minutes with me. So you may not want to get too cozy. I'm just kidding. But really, I want you to ask yourselves, Who or what inspired you to be a nurse? And I want you to reflect on this for a few minutes while I tell my story. So just imagine growing up in a house where your mom, who's sitting in the back there, was a registered nurse at the bedside, managing 6 to 8 patients on a busy diabetic medical surgical floor. And a father, who's also here today, was a hospital administrator where I swear he ran numbers and budgets in his sleep. Our dinner table discussion would include things like, Mary Ann, why did you get home so late? I thought your shift was over at 3:30. And then my mother would send him that glare, and it was the glare that we were all afraid of. And she would say, why did I get home so late? My father immediately knew to go no further, and it made for an interesting dinner conversation, to say the least. But in all honesty, listening to my mother's perspective and his perspective opened my eyes to healthcare as a whole. These dinner conversations may have also been the reason why my 3 older siblings wanted nothing to do with healthcare. They often said that I had my mom's qualities growing up, always nurturing and caring for others. My father would always say, you know, you're a spitting image of your mother, a real chip off the old block. I might have thought this prophecy in my early years, but I soon realized the honor that that very statement would hold. Human caring and empathy has no limits in my mother's eyes. Some may say it was genetic. As my grandmother, pictured here on the left, was also a nurse. She had a deep awareness of and sympathy for human suffering, and it brought her great joy to make a patient more comfortable. My mother's sense of compassion was exemplified by her mother. I actually really came from a family of nurses. My godmother, pictured on the right, also a nurse and an educator, was committed to lifelong learning, scholarship, and mentorship in an academic setting. So to say the least, I think my path was carved out for me, long before I knew it, and I was happy to begin my journey to fulfill it. So I began my studies at the University of Scranton and received my baccalaureate degree in nursing in 1999. I got my first job at Somerset Medical Center in their ICU. Lori was there. I just saw her for the first time today since then. And I started my adventure and profession as a nurse. I felt ready. I mean, I was a candy striper. I was a transporter. And I worked in the summers as a nurse's aide throughout college. I mean, this transition really can't be that bad. Oh, as our elder once says, to be in the minds of the naive. My mom's words echoing in my mind saying, are you sure you want to go into nursing? I quickly began to feel in the first years of my career the physical, mental, and emotional drain of a nurse. Often coming home and elevating my feet on pillows just because they hurt so much. Going 12 hours without a lunch break because there was no time to eat. Or simply because my patient never stabilized. And I spent many hours off the clock just trying to catch up on my charting. So I ask you and myself, what keeps our commitment to nursing when it can be so hard? And what makes us stay in this profession? I came across this quote and it brings such valuable meaning to me. Nurses are such a unique kind. They have an insatiable need to care for others, which is their biggest strength and sometimes their fatal flaw. I think it's our insatiable need to care for others and our ability to empathize with our patients that keeps us committed to nursing. How many hands have we held? Either to minimize our patients' fears, to help them feel less alone, or to comfort them when they're getting bad news. I will never forget the times that my patients, these grown men and women, said to me, can you just hold my hand? Everything in that moment just stops. The sounds of the patient monitors, the ringing of the phone, the list of orders that awaits you. You realize in that moment the vulnerability of this human being and how much they need you in that very moment. Our touch and our presence is all so powerful. So as I present to you today, I will reflect back on times of adversity in my life and how they've inspired me to be a better nurse and an educator. So this leads me to my first flashback. It was August of 1995, and I was traveling up to Westport, Ontario, Canada, to complete my preseason training for the University of Scranton cross-country team. I was a freshman, and it was my very first college experience. I was so excited and nervous about what the next 4 years of college would bring, and I was excited to be part of their cross-country team and start this adventure. We drove in 2 vans. One van was filled with the male runners on the team, and the other van was filled with the female runners on the team. The male van was driven by our assistant coach, who was familiar with the trip to Westport, Ontario, because this was a historical trip that the team did together prior to every season. The van filled with the female runners, which is what I was in, was driven by a senior male runner who had been to Canada in years past, but never drove members of the team up. We arrived to Westport, Ontario, and they announced we were only a few minutes away from the campsite. I sat up straight in my seat, and I took in the beauty that was around me. The hills, the windy roads, and the beautiful lakes. I thought to myself, this is going to be such an amazing experience. I think it was probably right after that thought that I saw this beautiful lake wolf here, pictured here, in front of me. And next I knew we were skidding on the rocks, and our driver was attempting to make the turn, but we didn't make it. We went off the cliff and into Lake Wolf. Our van submerged underwater almost immediately. I don't remember much about the van sinking, although my peers did. But I do remember waking up to darkness all around me. I felt things, maybe luggage floating, maybe my peers swimming within the van frantically, but I couldn't see much. I immediately thought, this isn't how it's supposed to happen. You're supposed to have some kind of warning before you die. I was a pretty religious person, and I thought that if you're going to die in a traumatic event, that God would take you up in these clouds and you'd be viewing the event from up there. You wouldn't be feeling the effects of drowning or fire, whatever that traumatic event was. But I was feeling it. I was holding my breath. I was panicking, and I was praying. Sorry. There we go. I said the Our Father, and either simultaneously or right after I said the prayer, I saw a bright light, and I swam towards it. I could see through the window the sun setting over the lake, and I could see the top of the water. I realized in that moment that we couldn't be too far down. So I turned my head to the right, and I saw the sun reflecting on some cracked glass. I escaped through that crack, and I made my way to the top of the lake, which felt like an eternity. But I made it, and I was alive. I remember that as some of us escaped the van, they asked us to line up. They asked me, who's still in there? I couldn't even answer them. I mean, I met these people like 4 hours ago. They started counting us, trying to figure out who was still stuck in the van. I was hurled over, coughing up lake water, and shocked at what just happened. One may say that your mind goes blank, but my mind didn't go blank. In fact, it was quite clear. The actual physical trauma was over, but the mental trauma was just beginning. So just like our patients, the surgery may be over, the chemo may be over, but the recovery of their body and mind is just beginning. And at that time, I was alone. I was far from my family, like many of our patients. And it was my first day experience in college, like many of our patients, it being their first time in the hospital, first time with the procedure, or first time in surgery. I was vulnerable. They are vulnerable. I'm often brought back to this moment in my nursing career to connect with that sense of vulnerability. I can truly empathize with those suffering trauma, and I'm a living example to tell you or to tell us we are placed in this profession for a reason. And you and I are so important and so needed every minute of every day. And your words and your presence are so powerful in these traumatic times in our patients' lives. So I ask you to do a little work right now. A priest once told me, when I was going through a rough time, he said, "You're a nurse, right?" And I said, "Yes." And he said, "You're so lucky. You have the ability to channel all of your anxiety, all of your frustrations, all of your empathy, and gift to care into people that really need it and will appreciate it and benefit from it. And you have the power to make a difference every single time you go to work. So let me remind you, wherever your focus is directed, that is really where your energy goes. And whatever you allow in your space, you will eventually become. So that's what I did. It's amazing what you can accomplish if you channel your caring nature into something that's productive, like your job. And guess what? People started to notice. They saw my passion, my drive, and my enthusiasm, and they started asking me if I would want to precept new nurses, like Katie, because they wanted me to share my energy and my spark for our profession. I won some awards for patient care and received letters of gratitude from our patients and families. I realized that it was in sharing my knowledge that I gained the most satisfaction, and I knew that I loved teaching. I decided to go back to school, and I had since moved to the Big Apple and took an amazing job at New York Presbyterian Weill Cornell. And I continued to commute back to New Jersey to get my ICU fix. And I decided to go back to school and get my master's in nursing education at New York University. I was determined to change the environment of nurses eating their young, and I wanted to shift some of my focus and channel my sense of nurturing and caring to my students and new nurses. Throughout that time, I met my first mentor. So I want to take a few minutes to talk about mentorship and how it plays a role in your personal and professional growth. Who is your mentor? Who do you look up to? Who challenges you? Who do you go to when you're at a crossroads because you know that either they've been down that road before or that because you value their feedback? Who believes in you? I mention this because having positive role models is one reason why I am in the shoes I am in today. Find someone who wants you to grow, someone who motivates you. Dr. Barbara Krainovich-Miller from NYU, pictured there on the left, and Dr. Kirsten Hickerson from the University of Pennsylvania have helped me pave the path of where I am today. These two individuals inspire me simply by their enthusiasm for their work, and they both advise me with honest intentions that have one overarching goal. And that is for me to grow. I often feel two things after my conversations with Barbara or Kirsten. One is that I always leave the conversations with more questions than I came with. And I always feel like my brain just ran a marathon. It's kind of like that feeling when you're done running and you feel totally mentally exhausted, but at the same time, you feel like you're on a high. That's how I feel after I talk to both of them. Find someone like that. They stretch my mind and give me the confidence to take on new challenges. They both encourage me to choose courage over comfort, and they never let me think for a moment that I will be able to get everything out of an opportunity without feeling scared or nervous. They have taught me that growth happens outside of our comfort zone. So I continued my journey inspired by my mentors, and I relocated from New York City to Philadelphia to follow my dreams to be an educator. I was determined to change the environment of nurses eating their young, and I wanted to shift some of my focus and channel my sense of nurturing and caring to my students. I knew there had to be a better way to teach our nurses the skills they needed to be competent practitioners, other than on-the-job training. And I was determined to find a way to engage them through simulation or experiential learning. So in spring of 2008, I had the great opportunity to take a position at the University of Pennsylvania School of Nursing. I was very interested in exploring opportunities to educate new nurses by recreating existing or previous experiences. Simulation was the perfect venue to do this. So that is what I did. I worked part-time at HUP, part-time in the PACU, and I spent a lot of time or part-time at Penn, part-time at the PACU, and I spent a lot of time writing clinical scenarios that were realistic and could prepare our nurses for the real world. So why simulation? For those of you that graduate nursing school or college before they use simulation, imagine what it would be like to engage in critical thinking without the possibility of endangering the patient. Imagine if you had the opportunity to practice end-of-life discussions before it was the real thing. And imagine if actually someone was sitting there that specialized in how to communicate bad news and gave you feedback on your performance so you could be more empathetic. What if you had the opportunity to manage multiple patients before having to experience it in the real world after you graduated? Or had the opportunity to care for unstable patients before it became the real thing? Or to see the consequences of what could happen to a patient if you didn't titrate their medication correctly, or if you didn't call the provider about their abnormal findings. Well, that is what we're doing now at Penn School of Nursing. So let's think about this. For all these years in nursing education, we sent our students to lectures and clinical. How many of you felt really prepared to take care of a patient who was writhing in pain, despite multiple doses of pain medication, was hypotensive, and still pleading with you to give you more because they were so uncomfortable? How did lecture prepare you for how to respond to that? It really didn't. What if I had the opportunity to practice that scenario in a simulation prior to the real thing? So where do you think simulation would fall in this learning pyramid versus taught through a lecture? Nursing finally began to build off previous successes in training in aviation and military, where they used simulation since the late 1970s and early 80s. And we began to look at how our learners translate knowledge into clinical practice. Oh, there we go. I think simulation actually is a perfect setting for this. Simulation gives us the ability to engage the learner through physical, conceptual, and emotional fidelity. And these three levels of engagement are actually what contribute to the realism of the scenario, or the buy-in, or the engagement of the participant. In simulation, we could actually achieve physical fidelity by having the patient blink, dilating their pupils, creating pulses, blood pressures. We could have CSF come out of their ears. We could have blood come out of their arteries. So we could do lots of different things to make it seem real for our students. In addition, we can create conceptual fidelity, which is the if-then relationship. So if the patient's hemorrhaging, we can make the blood pressure low. We can make the patient tachycardic. We can make them pale. And we can also simulate emotional fidelity, or achieve emotional fidelity or experiential fidelity, which is the level of activation combined with feelings. So we can create an unpleasant feeling in the learner. So if they gave too much insulin, we can create the simulator to sweat, make the simulator sweat, or have the simulator report fatigue or shakiness. And remember what that does to the learner. It really prevents them from making that mistake again. So as a simulation educator, we really believe this is a very effective teaching methodology to help our students get engaged and to translate knowledge into clinical practice. I started to create more challenging and unique scenarios that engaged our learners and prepared them for the complexities of our patient populations today. The picture above is a mass casualty simulation that I created. We now offer it twice a year to our undergraduate students, and it enables them to practice how they identify themselves in a group setting or an emergency setting. What victims or patients do they tend to gravitate to? And do they assume the role of leadership, or do they become task-saturated? Or how do they respond in an emergency? At this point, I really drank the simulation Kool-Aid. I was sold, and this quote by Confucius became embedded to me as an educator. I see and I forget, I hear and I remember, I do and I understand. And then I received one of life's greatest joys in 2009. I had my son right here at Pennsylvania Hospital, Joseph Patrick Brennan V. I truly had it all, a profession that I loved and a family that fulfilled all my senses. I knew that I quote unquote had it all, but I still kept in mind the tightrope that I was walking. All the while promising to live my life to the fullest, remembering that any given moment, it can be taken away from me again. So remember what I said. I want you to identify life experiences and adversity in your life as an impetus to educate, empathize, and innovate to create a positive impact in our workplace, our local communities, and global society. I had just started back at work after Joey was born. He was only 5 months old. As I mentioned, I thought I was living the American dream. I had a career I loved and a husband and son I adored. But on December 5th, 2009, I found out that my husband was leaving me. You see, my ex-husband struggled with many demons, but I never thought I'd hear the words, "I don't want to be married to you anymore." I am not sure if anyone out there has loved anyone that has struggled with addiction or substance use, but it's quite a roller coaster ride. For some substance users, the threat of loss motivates him or her to quit, but for others, it doesn't. It is not until you realize that in the substance user eyes, there is no choice. There is no rationalization when you're up against addiction sometimes. And there definitely comes a time in a substance abuser's life where in their own body and mind, there is only one thing they want. And that high can come in various forms, but whatever that form is, your family, your kids, their job, will never live up to it. That feeling of defeat for a nurse is really hard to swallow. What do you mean we can't fix it? We're fixers. Why can't I fix this? Remember that saying that I showed you earlier. Sometimes we have an insatiable need to care for others, but sometimes it could be our biggest strength, and other times it can be our biggest flaw. I was determined, though, to make it my biggest strength, and remember hearing that it's not whether you get knocked down, but it's whether you get back up. And anyone can see adversity in a difficult situation, but it takes a stronger person to see it as an opportunity. So I asked myself, what are you going to do? And I went back to what I heard before, and I said, I'm going to channel all this. I'm going to nurse my heart out. And something good will come of this again. I had to believe it. So I put all my anger, all my sadness, all my disappointment, and I channeled it now into teaching. And I decided I would not give up until greatness happened. So in this dark time, I had a silver lining. And it's one that I share with every single one of you. And that is our education. We have an education. So in 2011, I met this awesome group of colleagues from the Center for Resuscitation Science. They challenged me to incorporate simulation into training. So instead of going from one presentation to another in conferences, we taught in breakout stations using simulation. So the participants learned about the benefits of therapeutic hypothermia via presentations and then immersed themselves into various cardiac arrest simulations to apply what they've learned in an active environment. I started to look at simulation differently, and in 2011, I started to work together with Penn Medicine Clinical Simulation Center and helped them implement their first official in situ simulation in the health system. Now they do about 123 in situ simulations since then, yearly, and they train over 10,000 individuals per year within the health system using simulation. In February of 2016, I continued to channel my passion for teaching and drive and was asked to consult for Columbia University as they began to develop their state-of-the-art simulation learning laboratory. And back at Penn Nursing, I started the new model in community courses to use what we call now content experts in simulation. The goal of content experts was to better simulate a clinical experience to mimic real life. What actually stimulated this idea was a recovery room scenario that we conducted in our sim center. I was listening to other sim instructors trying to simulate a patient emerging from anesthesia. I wanted to bust right in there and say, I can do this way better than all of you because I am a PACU nurse. If I'm doing a diabetic simulation, then I want the nurse that has worked at the bedside with a diabetic for 10 years because I know they can best simulate that hypoglycemic episode. Not me. Him or she can ask questions that these patients most typically ask and really give our students a realistic experience. So I started doing more simulations like this, and in areas that were more specialized, like end-of-life discussions, intimate partner violence, home care, and school nursing. At this time, team training began to emerge, and simulation was identified as a great method to achieve team performance outcomes. I started to ask the questions, how should we educate students of various health professions to work better in teams? Can the provision of healthcare be improved by closer interactions of healthcare professionals in new ways? And can the education of health professionals together facilitate cooperative endeavors that are so urgently needed in practice? So I picked up the phone and I called the School of Social Policy and Practice. And I kept calling until someone listened to me. And then I found someone who was interested in collaborating, and now we have multiple simulations that incorporate social work, advanced healthcare providers, even the School of Dentistry, so that our students have the opportunity to practice communicating in teams, have a better awareness of their roles and scopes of practice, and ultimately so our patients have a greater opportunity for improved outcomes. So I tell all those naysayers, let's just give it a shot. And remember, sometimes it's better to ask for forgiveness than to ask for permission. So in 2016, we received a grant to conduct an interprofessional simulation that involved the Graduate School of Education, the School of Social Policy and Practice, and nursing. And together, we worked with these three schools to implement a simulation that involves students that were studying either to be principals or administrators. Then we involved our school nurses who were practicing in the role of, our nursing students that were practicing the role of a school nurse, and our social work students that were practicing the role of a school counselor. The goal of the simulation was to better the resources and communication and the mental needs for our LGBTQ adolescents in a school setting. It was awesome. So in fall in 2014, I married my husband, Chris, who's sitting in the back. My farmer, I call him, because he is. He's an amazing man and husband and father, and someone who inspires me and relishes in my growth. Remember that thoughts become things. If you see it in your mind, then I promise you will hold it in your hands. And the secret of change is to focus all your energy, not on fighting the old, but building the new. And we built something great. But that tightrope, I had to remember never to get too comfortable. I always have to keep in mind that life is a gift and never to take it for granted. So they say things happen in threes, but I was faced with the opioid epidemic. If you know someone or ever knew someone that has or had an opioid use disorder, then you can empathize with me here. Unfortunately, I have, but I refuse to be comfortable or throw my hands up in the air and say there isn't much I can do about this epidemic, because I knew deep down that there was some way that I could have impact. So in 2017, I started my journey to help families of loved ones and to identify behavioral and physical signs of opioid use and abuse. In addition, I was determined to find individuals in recovery to simulate these signs, because they were the ones that only can do it best. And to help educate us on the various signs to look out for. In addition, I knew simulation was a great tool to help and train students, teachers, and loved ones how to administer naloxone in an emergency. In 2016, 65,000 people died from drug overdoses in the United States. That's alarming. Current estimates suggest that 90 to 120 people die every day of opioid overdose. And we're looking at in 2016 that drugs killed more people than car crashes and guns in our country. In Philadelphia, we face it hard on here, because in 2016, the report came out that there are 3 times as many deaths for drug overdoses than there are in homicide. So we have to do something. And And education is the most powerful weapon that we can use to help change this epidemic. So just this past February, I worked with the Center for Public Health Initiatives, Prevention Point, which is out of Kensington, Philadelphia, and Penn Nursing, and we received approval to train students in our Penn community on the opioid epidemic and provide the naloxone training. We hired individuals in recovery and included content experts in our local area to simulate the physical signs and symptoms of opioid use. We were able to demonstrate the behavioral and psychosocial signs of the use. The students or the learners were able to practice rescue breathing of a fentanyl or a heroin overdose, and they were able to practice administering Narcan. Lastly, they were able to participate in what was probably the most beneficial, which was a collaborative discussion with the substance abusers themselves, recovered substance abusers, content experts, and verbalized understanding of resources that were available now to opioid users after we resuscitate. There we go. So yesterday, we packed up our simulators and took them for a joyride in my minivan to Pierce College, where we trained 60 to 70 volunteers from the Bethesda Project that serve the homeless and taught them how to respond to an opioid overdose in the Philadelphia community. They practiced rescue breathing and they practiced the administration of Narcan using simulation. I still wasn't satisfied though, because I wanted this training and information on naloxone and the opioid epidemic to reach more people. I had a vision of filming the training and disseminating the information more broadly via the web, but I didn't want to lose the fidelity of the hands-on experience for the learner. And I knew that using virtual reality could potentially achieve these goals. So I shared my vision with 3 of our PhD students, Claire, sitting here, and Claire applied for the Hillman Scholar Grant in March. We just received approval and for the grant and the money so that we could launch this training in the summer or fall of 2018. Now my vision can be a reality. Virtual reality is a way or a computer-generated simulation of a 3-dimensional environment that can be interacted with in a seemingly real or physical way by individuals using glasses or special electronic equipment with a screen inside. So today, I hope I inspired you to follow your passion, your path, and use your life experiences to connect and to relate to your patients or your students. I hope that you continue to empathize and care to your fullest capacity and nurse your heart out. Because you won't just be celebrating your patients' victories, but you will also be celebrating your own. And remember to lead by example and follow those that want to see you succeed and grow. So are you ready? Because the time is now. I want you to inspire, to empower, and to educate. And I want you to share information with your colleagues, because when we all think alike, no one is thinking. We need to come up with new, innovative ways to make an impact in our society. So start taking things that exist and put them together in new ways with your peers and with your colleagues. So start that fire, and remember, from a little spark may burst a flame. And it's not the position that makes the leader, it's the leader that makes the position. Thank you.